If you have psoriasis or psoriatic arthritis, you've probably already considered medications, creams, lots of different things to put on. But did you know that your grocery cart could be your secret weapon? Let's go shopping for some foods that have some real science behind them to help inflammation, joint pain, and improve overall health and well-being. I'm Dr. B with Plant Forward MD, a rheumatologist and culinary medicine specialist. Psoriatic arthritis is not just about your joints, just like psoriasis is not just about the skin. This is a total body inflammation. So today, let's cover some powerful foods backed by research, plus the diet that is most studied and helpful for psoriatic arthritis. Spoiler alert, it's not the same Mediterranean diet that you hear about for rheumatoid arthritis. All right, let's grab a cart and go shopping. What's happening to your skin is related to what's happening inside of your body, especially your gut. Research suggests that many people with psoriasis or psoriatic arthritis have a heightened sensitivity to gluten. And this is really important because the first category we're going to talk about is carbs. But not all grains are created equal, especially when it comes to inflammation. Whole grains like quinoa, oats, brown rice have been linked to lower levels of CRP, C-reactive protein, which is a marker of inflammation. Not only do whole grains provide fiber, but they also stabilize blood sugar, reducing spikes that can fuel inflammation. And unlike refined grains, and those are things like white bread, processed cereals, and pastries, whole grains have been linked to lower inflammation overall in autoimmune conditions. But here's where things get interesting, because not everyone with psoriatic arthritis or psoriasis benefits from all grains. And gluten sensitivity can definitely be seen with this condition. It's not everyone, but it's a stronger connection here than it is in other autoimmune diseases. And we're going to get to that in a bit, because if you do want to try a gluten-free diet, you have to keep in mind these 6 things that we're going to talk about. But for now, in your shopping cart, turn to the good stuff and get in those whole grains and avoid the bad stuff. That brings us to the second one. And while we're talking about the gut, let's talk about gut microbiome support for inflammation, because your gut microbiome plays a huge role in immune balance. And fiber is its favorite fuel. When gut bacteria ferment the fiber, they produce something called short-chain fatty acids, which help reduce inflammation. So why does this matter? A high fiber diet supports a very diverse gut microbiome, which has been shown to reduce inflammation and is linked to better immune regulation in psoriatic arthritis. So let's add this to our grocery cart and load up on beans, lentils, fruit, and cruciferous vegetables, okay? Get those in your cart. Now let's move on. Okay, now that we've headed down to the next aisle, let's grab our oil. The most studied oil for this is olive oil, specifically extra virgin olive oil, which was done at a research study in Italy, and they found that people following the traditional Mediterranean diet had lower psoriasis severity scores. Okay, so this was one study on diet. And one of the biggest players that they thought helped was extra virgin olive oil. Now, olive oil comes in many different flavors, colors, and backgrounds in terms of which olives that they use. It contains hydroxytyrosol, which is a polyphenol that has strong anti-inflammatory effects. Some olive varieties actually have more polyphenol. Certain olive, and these were the Koroneiki olives, which is Greek olive oil, Picual olives, which is Spanish olive oil, Morello olives, which is Italian olive oil, were considered better for these beneficial compounds. So check the label of your olive oil to make sure that you're getting the right kind. Yes, go for the greener ones, but it's a little bit more complex than that. And not to say that the other seed oils or any of those other oils are necessarily bad for you, but we do have more studies on olive oil, especially the omega-3s that are in it. You know, there's omega-3 and omega-6 ratios that kind of make a difference. But overall, you don't need to pour the olive oil. You need to use less because it is a calorie-dense food. And so overall, eat healthy foods, eat a variety of foods, but don't necessarily douse them all in different oils. Okay, let's move on to the next aisle where we're gonna look for omega-3s. So omega-3s can help reduce inflammation. And research shows that people who had more omega-3s in their diet had lower psoriasis severity scores. Now, where can you get those omega-3s? Okay, which aisle should we go to? Well, if you eat seafood, then fatty fish was definitely an aisle where you could go and get salmon, sardines, anchovies, and by the way, sardines have a high calcium content as well. And if you're not getting it fresh, you can get it flash frozen. Those are also considered just as good. Now, if you're vegan or vegetarian, you also can benefit from omega-3s because the seafood gets it from the algae, right? Which is being eaten by the fish. So indirectly, you're still getting the same compound, and you can buy it in terms of supplements, or even better, what I love, of course, is food. So walnuts, chia, flax seeds all have a ton of omega-3 in them. So drop some of those in your grocery cart and let's get going. There was a small study with coffee, which I love, so I was happy to hear this, but coffee can help reduce the inflammation. You don't want to overdo it, not more than 3 cups a day, so maybe just stick to a cup or 2. And this is because it's associated with a polyphenol called chlorogenic acid. Now, chlorogenic acid has these natural anti-inflammatory properties, but remember, stick to moderation. This doesn't mean you should have a big cinnamon bun latte doused with lots of cream, sugar, milk, because that's probably counteracting the active good compounds that you're going to get from the chlorogenic acid. So be careful on that. Our next aisle that we're going to go down is the leafy green vegetable and the berry aisle. You always want to have tons of those because they're going to play back into our fiber, and we want to have fiber for a healthy gut, right? A lot of things stem from the gut and they're reflected in different areas of the body. So go for all of those different rainbows. A cup of raspberries is 8 grams of fiber, so we love those. Love the colors, we love the blueberries, strawberries, any berries you can get your hands on. Frozen is also good. And leafy greens, whether it's Swiss chard, kale, spinach, there are so many different varieties out there. Just make sure you're having them. Just add them to your soups, salads, your meals, on the side dishes, anywhere that you can. Our cart is getting pretty full. We're heading towards the end because we're going to talk now about diet. Now, earlier I told you that psoriatic arthritis research isn't focusing as much on the standard Mediterranean diet like in rheumatoid arthritis. The diet that is most supported by the research right now is more of a calorie-restricted diet, but more of a calorie-conscious Mediterranean diet might be better, especially one that's focused on weight management. Studies show that weight loss in psoriatic arthritis patients leads to lower inflammation, less joint pain, and better medication responses, right? Because there are some people that certainly I know that I've had trouble in my practice, as have many other rheumatologists. Body fat itself is necessary. So I don't want you to think to yourself, you don't need body fat. You absolutely do. But it's this ratio that we need. And when we have excess of that ratio, we consider that fat as more of an inflammatory organ. And sometimes, despite somebody being on disease-modifying drugs, maybe even steroids, maybe even NSAIDs, maybe even biologic medications, we just cannot get that disease under control. And sometimes it's because of the weight. So a Mediterranean style diet that is high in olive oil, whole grains, and omega-3s has been linked to lower psoriasis severity scores, but when it's combined with weight management, the benefits are even stronger, okay? So it's not just directly Mediterranean diet, it's more of the calorie-restricted diet with the Mediterranean kind of focus. And I'm not talking about the Mediterranean diet of today. Like if you go in that region, there's all this fast food, ultra-processed foods, all the foods that we're saying stay away from, right? I'm talking about the traditional one. Okay, let's dive back into the gluten and psoriatic arthritis psoriasis connection. Celiac disease might be something that you've heard of. It's about 1% of the population who has this allergy to gluten. It's not that common, right? It's 1%. But when you have psoriasis or psoriatic arthritis, you could have a heightened gluten sensitivity. It's kind of a new field being researched, and they're finding that maybe up to 13% of the population is more gluten sensitive, or they may get other side effects, perhaps in terms of skin manifestations or somewhere else. Patients ask me, should I go on a gluten-free diet for my psoriasis or psoriatic arthritis? I think that could be worth a trial definitely for some people. And usually a trial is about 4 to 6 weeks. So you may first have gotten a colonoscopy if you have GI complaints, right? If you're having a lot of bloating, anemia, weight loss, any of those, you should probably go ahead and get evaluated with a colonoscopy to see if you have true celiac disease. But if not, and you just wanted to give it a trial, you could try to give up gluten for 4 to 6 weeks and see what happens. But you have to remember to have other nutrient-dense foods because you're giving up one food, you don't want to give up all of your nutrients. And you have to be careful because there's a lot of condiments also that have gluten in them, like ketchup, soy sauce, even some salad dressings. So if you want to follow this, something you can add to your cart is quinoa, brown rice, lentils. You can do oats, but just make sure that they're gluten-free oats because a lot of time there's gluten hiding in them. If you don't want to go gluten-free completely, you can just try avoiding certain products. But really, if you wanted to see if you were gluten sensitive, you kind of would have to do the whole thing. And if you do want to try a gluten-free diet, there are 6 things I want you to look for. How is your joint pain? How's your joint stiffness? Do you have brain fog or fatigue? Are you less bloated? And how's your skin doing? right? So check out these 6 things if you want to give up gluten. What's the benefit? Because if nothing changes, there's no point in pursuing it. Look elsewhere to see if there are food triggers for you. So while the individual food that we eat helps, right, all that stuff we stuck in our grocery cart, it's also about eating in a way that supports overall inflammation control and a healthy weight. This is how we make every meal work for us, not against us. Which of these foods are already in your grocery cart? Drop a line in the comments. I'm Dr. B with Plant Forward MD. I'll see you next time for more tips about health.